what has been the main focus to date, I would say, in relation to the microbiome and hematopoietic cell transplantation was mainly the stool microbiome. However, we know that obviously the oral microbiome is very diverse and potentially could contribute to some of the post-transplant course, including complication. And one sort of biologically appealing idea is that the oral microbiome could potentially modulate oral mucositis, which is a very common complication of hematopoietic cell transplantation. So what we did back in Sheba Medical Center is actually serially sample the oral microbiome or the salivary microbiome in 184 patients treated with hematopoietic cell transplantation. We prospectively documented oral mucositis, and we found some interesting findings. First, and that I would say is maybe expected, that patients developing severe mucositis, oral mucositis, were more likely to become dysbiotic at the time. The oral microbiome was more likely to become dysbiotic at the time of oral mucositis. But we could also identify bacteria that were predictive of the development of severe oral mucositis. For instance, we found enrichment of Klebsiella at baseline in patients later on developing oral mucositis. And this is very interesting because this could be, for instance, an avenue for intervention. We also found some bacteria that were associated with changes at the time of oral mucositis, for instance, Mycoplasma. Now, another avenue that we studied is metabolomic changes in patients in oral mucositis. And what we found there is that there is dysregulation of the polyamine pathways at the time of mucositis. And this was very interesting because we know that the polyamine pathway is very important for epithelial homeostasis, and could therefore be another target for interventions. And sort of the next steps that we were doing now is trying to better understand mechanistically how the polyamine pathway could contribute to development of mucositis and whether interventions in this pathway could prevent or treat oral mucositis.